High blood pressure is often called the silent killer, and that's not just to be dramatic. It's a very real description of what can happen inside your body without you even knowing it. Most people with high blood pressure feel completely fine. No pain, no warning signs, nothing obvious at all. And yet, day after day, year after year, that increased pressure is quietly damaging your blood vessels and putting strain on some of the most important organs in your body. That's why it's so dangerous. You don't get a symptom to warn you before the damage starts to add up. If it's your first time here on my channel, my name is Hafiz and I'm a cardiologist based in London. I create videos to help you keep your heart healthy and explain heart conditions in a way that I hope is easy to understand. If that interests you, then click on the subscribe button and bell icon so you get notified every time I release a video. To understand why high blood pressure is such a problem, it helps to understand what blood pressure actually is. Every time your heart beats, it pushes blood through your arteries to deliver oxygen and nutrients to your brain, kidneys, heart muscle, and the rest of your body. That pressure is necessary, but when the pressure stays too high for too long, it's like forcing water through a hose at high pressure all day, every day. Over time, the lining of the hose gets damaged. In your body, that lining damage makes arteries stiffer and more prone to disease. Now, high blood pressure, known medically as hypertension, is really common. It affects 1 in 4 people, and most people don't even know they have high blood pressure. And high blood pressure can be caused by lots of things. I've done a separate video explaining why your blood pressure is high, so check it out after you watch this video. One of the biggest dangers of high blood pressure is what it does to your arteries. Persistent high pressure damages the inner lining, making it easier for fatty deposits to stick together and build up. That process, called atherosclerosis, narrows the arteries and reduces blood flow. If a plaque ruptures and a clot forms, blood flow can suddenly be blocked, and that can cause a heart attack. So when we talk about blood pressure, we're not talking about a number to ignore. We're talking about a risk factor that can lead directly to life-changing events. Your brain is another major target. High blood pressure is one of the most important risk factors for stroke. It can contribute to blockages that stop blood flow reaching part of your brain, and it can also weaken vessels so much that they rupture and bleed. Both types of stroke are medical emergencies, and both can lead to long-term disability affecting speech, movement, memory, and quality of life. That's why controlling blood pressure is about protecting your future, not just treating a number. Your heart itself also takes a hit. When blood pressure is high, the heart has to pump against more resistance. Over time, the main pumping chamber, the left ventricle, can thicken, but a thicker muscle becomes stiffer and actually less efficient in doing its job. Eventually, this can lead to heart failure, where the heart can't pump blood as effectively as your body needs. And this is one of the reasons people can develop symptoms like breathlessness, swelling in their legs, and fatigue later in life because the heart has been forced to work too hard for too long. Then there are your kidneys. Your kidneys rely on a dense network of tiny blood vessels to filter waste and balance fluids and salts. High blood pressure damages those delicate vessels, and kidney function can slowly decline over time. Many people don't realize how closely high blood pressure and kidney disease are linked until the damage is already significant. And the key problem is that all of this can happen quietly. You don't feel your arteries stiffening. You don't feel early kidney damage. You don't feel your heart muscle slowly getting thicker under strain. By the time symptoms show up, there may already be a lot going on under the surface. That's why the silent killer label fits so well. Now this video is sponsored by Hilo. Hilo is a band that you wear on your wrist, and it provides continuous blood pressure monitoring throughout the day and night, even when you sleep. It works by shining a green light to analyze how your arteries below your skin surface pulsate. This is the same sensing principle as most other smartwatches. But this device goes beyond just a heart rate monitor, and instead of counting pulses, it examines the shape, which gives information on your blood pressure. And they have tested their technology in clinical trials. I've actually tested the device myself, and I've had a positive experience using it. What I like is that it makes checking blood pressure feel easier to keep up with. If something is bulky, awkward, or easy to forget, people stop using it. When it's convenient, you're more likely to stay consistent, and consistency is key with blood pressure. So when you receive your Hilo box, there is the Hilo cuff, which you use first to calibrate the band so that the optical sensors are accurate to your specific blood pressure profile. They also have an app which can help to track your trends in your blood pressure over time and see how your daily habits affect those trends. You are able to view your trends over one day, over weeks, and over months. This may help for you to identify how your lifestyle is affecting your blood pressure to give more insights about your health. Now, there are some caveats. The Hilo band is not intended to be used to diagnose high blood pressure. You still need a blood pressure machine and diagnosis by a healthcare provider. The band is also not to be used if you have an abnormal heart rhythm like atrial fibrillation, any condition that impacts blood flow to your hands like diabetes or kidney impairment. It's also not intended to be used on pregnant women or if you're aged below 21 and above 85 years. Having said that, I think these cuffless blood pressure monitors have a lot of potential and could really change the way blood pressure is monitored. It's currently not a replacement for the traditional validated blood pressure devices, particularly for people who have difficult to treat blood pressure. But I think it reminds us of the importance of knowing our numbers and being in charge of our health. So how can we reduce the dangers of blood pressure? First thing is to know what your blood pressure is. Regular monitoring, especially if you have risk factors like diabetes, can catch problems early when you can still prevent long-term damage. Second, understand that risk builds over time. A single high reading doesn't automatically mean you have hypertension, but repeated high readings do matter. The danger isn't one bad day, it's months and years of raised pressure. That's what increases the risk of heart attacks, strokes, heart failure, and kidney disease. Third, take lifestyle seriously because it generally works for many people. Salt intake is a big one. Too much salt makes your body retain fluid, increasing the volume your heart has to pump and raising pressure. Reducing salt, eating more fruits and vegetables, and following an overall heart-healthy diet can help. Regular physical activity improves blood vessel health. Weight loss, even modest, can lower blood pressure. Reducing alcohol and avoiding smoking also make a real difference. And if your doctor prescribes medication, take it consistently. I know a lot of people don't like taking medication, but if you think of it as a protective measure rather than a personal judgment, then that can help shift the perspective. Many people also stop taking their medication when they feel fine, but the whole issue is that high blood pressure often doesn't make you feel unwell. Medication is not about treating symptoms, it's about preventing damage. Another common trap is thinking that once your blood pressure improves, you can stop everything. Often improved readings mean the plan is working, whether that plan is lifestyle, medication, or both. Long-term control is what protects your organs. The goal isn't one good week, it's protection over years. If you ever see readings that are consistently high, don't panic, but don't ignore them either. Track them properly and talk to your doctor. If you get symptoms like chest pain, severe breathlessness, weakness on one side, face drooping, or trouble speaking, treat that as an emergency. So the message is simple. High blood pressure is dangerous because it's common, it's silent, and it steadily increases the risk of major events like heart attack and stroke. But it's also one of the most powerful opportunities we have to prevent future harm, because once you know your numbers, you can do something about them. Thanks so much for watching. If you found this explanation helpful, please give the video a thumbs up, subscribe, and share it with someone who might benefit. See you next time.